So, we've done discussing the two among the four distinct forms or adaptive responses of cells when they are exposed to stress or stimuli. The other adaptive responses of cells that I will discuss are hyperplasia and metaplasia. And I have also included dysplasia and will be tackling it at the end. As discussed earlier, cell adaptation occurs when the normal cells in the body are exposed to any stress or any injurious stimuli or stimulus. Nakita rin natin sa figure kanina sa diniscuss ni Carlos na kung ang normal cell ay or yung normal state ng cell ay na-expose sa stress, doon nagkakaroon ng cell adaptation. Pero kung ang cell ay hindi nakapag-adapt sa stress due to the stress excessiveness or due to injurious agent o kaya na-deprive siya ng essential nutrient na kailangan niya in order to function well despite the stress, doon na nagkakaroon ng cell injury. Example is when you are riding a bike and then nahulog ka roon at naitama or nag-slide ka sa semento, then your skin cells will probably get damaged and they can't adapt to that kind of damage or pressure. Then that is cell injury. So another cell growth adaptation is hyperplasia. First, we will discuss hyperplasia. So what is hyperplasia? Hyperplasia refers to an increase in the number of cells in an organ or tissue, which are cells that are capable of mitotic division, may divide when stressed or stimulated by increased activity, and thus constitute hyperplasia. Hypertrophy and hyperplasia are closely related that often develop together so that both may contribute to an overall increase in organ size. Hyperplasia can be either pathologic or physiologic. So, ang hyperplasia is the increase in the number of cells in an organ or tissue. Example of hyperplasia is those cells capable of mitotic division may divide kung na-expose sila sa kahit anong uri ng stress or kung sila ay na-stimulated by increasing activity or nagkakaroon ng higher demand of workload and thus constitute hyperplasia. Hyperplasia is about having one cell at of course merong stress na nailagay or na-expose na cell, then what happens? Kung sa hypertrophy, pag ang cell ay na-expose sa stress, yung cell ay nag-enlarge or lumalaki. Pero pag hyperplasia naman, it is more like ang mangyayari ay magre-reproduce ang cell and as they are reproducing, they are trying to not get injured also. Parang oy, kailangan lang namin mag-reproduce. I need more of me. Ganon. Oh, so that is hyperplasia. So now, paano naman natin malalaman whether mag-undergo ng hypertrophy or hyperplasia ang cell? Para malaman natin, we have to look at the cell type. Bakit? Bakit kailangan natin isaalang-alang din ang types ng cell? Dahil ang cell type ay ang nagdidictate kung ano ang mangyayari sa cell. Kung mag-undergo ba siya ng hypertrophy or mag-undergo siya ng hyperplasia. For example, si Carlos, gusto niya i-workout yung biceps niya kasi parang maliit para sa kanya. At gusto niyang palakihin. So, syempre, anong gagawin niya? Pupunta siya sa gym at mag-workout, like maglilift siya ng mga weights, ganon. And then after some time, syempre, sa pag-gym niya, yung biceps niya lumaki. It became bigger. Dahil na rin roon sa pag-workout niya. Thus, the cell on his biceps undergoes hypertrophy. While, kung yung skin cell naman, like my skin needs to become more tough, then my skin cells must undergo hyperplasia. Dahil ang skin cell ay may kakayahan to multiply rapidly than of a muscle cell. Na-discuss nga na ang hypertrophy at hyperplasia ay closely related, na they are often coming or develop together na nagli-lead sa contribution nilang dalawa sa overall na pag-increase ng size ng organ or tissue. So kailangan natin huwag malito sa dalawang ito, especially sa the way sila mag-adapt sa mga certain stresses. So review lang, ang hypertrophy ay ito yung pag-increase ng size ng cells. Tapos ang hyperplasia naman ay yung pag-increase ng number ng cell. So yun. Hyperplasia can be physiologic and pathologic. Yan. Physiologic hyperplasia ay nagdi-divide sa dalawang categories. The first category is physiologic hyperplasia. It occurs due to abnormal stressors. Example of physiologic hyperplasia is the hormonal hyperplasia. Hormonal hyperplasia is it increases the functional capacity of a tissue when needed. Example, yung pag-increase ng number of cells in female breast due to puberty and lactation. Di ba ang breast natin na mga babae ay nagkukonsist ng 15 to 20 sections na tinatawag na lobes. Each lobes ay may mga maliliit na structures doon na tinatawag na lobules. This end in dozens of tiny bulbs that can produce milk. So, when it is stimulated by the hormones of pregnancy and birth, nag-i-increase yung functional capacity ng cells sa breast, which then lead the lobules na mag-produce ng milk. So yun yung example ng hormonal hyperplasia. Next example of physiologic hyperplasia is the compensatory hyperplasia. Compensatory hyperplasia is the increase in tissue mass after damage or partial resection. Some organs that undergo compensatory hyperplasia and regenerate our skin, yung liver at saka yung bone marrow. Example of compensatory hyperplasia is pag nagpuputol ng kahoy. Di ba pag due to too much stress sa kamay, sa paghawak ng itak or yung axe or yung tinatawag na wasay sa Ilocano, pag nagpuputol ng kahoy, then your hands could get calluses basta yun, magkakaroon ng mga callus sa kamay mo. Which this means na the demand of workload is increases. So, the cells in your hand divides to satisfy the increase of demand and then regenerate itself after some time. Di ba pag nagkakaroon tayo ng callus sa kamay, pagka nagre-regenerate din siya after some time pag lumipas ng taon. Another example is
Tapusin mo muna to.
Sige. Another example is when a person's liver is resected or cut out, then yung remaining liver ay mag-enlarge through hyperplasia. Tulad din sa kidney, kung ang isang tao ay na-cut out yung kidney niya, then the other kidney will become hyperplastic to compensate. So that is physiologic hyperplasia. May time pa? Carlos, may time pa?
Ano sinabi kanina? I-next ko agad para hindi makita kasi sa ano eh.
Unlimited na. Na-upgrade na.
Sige.
Ay, go lang.
Cut na lang.
Next slide. 1. The second category is pathological hyperplasia. It occurs due to an abnormal stressors. Pathologic hyperplasia includes repeated and prolonged irritation. This happened through mechanical, chemical, and thermal agents. And other pathological hyperplasia is endocrine disturbance. Next slide. Infectious causes. Next slide. And then wound healing. So these are the things that causes hyperplasia in cells. For example, the endometrial hyperplasia due to the excess production of estrogen. Another example is metabolic problems such as hypocalcemia can result in hyperplasia of the parathyroid glands. Hypocalcemia is a condition in which there are lower than average levels of calcium in the liquid part of the blood or the plasma. So that is hyperplasia. Next, one of the adaptive responses of cells is metaplasia.